A new patient came to see me the other day for an initial consult. Now, this is a patient who has had breast cancer-related lymphedema for a long time, and she was telling me how compliant she is with her garment wear, with using her pump, as well as with her self-MLD practice. So when we were reviewing all the things, including her self-MLD routine, she told me that she has always been taught that you need to perform MLD with the pressure that you would use as if petting a cat. Now, as you can see, I'm a dog person, and I feel like the pressure I use when I'm petting my dog is not nearly the pressure I would use in most of my patients when performing MLD. My name is Lisa Sylvestri. I'm a physical therapist and a certified lymphedema therapist, and my goal is to make us all lymph smart. So my question is, when would light touch be really appropriate for anyone performing self-manual lymphatic drainage or self-MLD? If you are a patient who has a normal lymphatic system, or you are dealing with the remnants of a cold and your lymph nodes are a little bit swollen still and you're trying to get them down, but there is really no problem with your lymphatic system overall, then perhaps this really light touch may be beneficial in helping you move fluid along your lymphatic system a little bit more effectively. But if you have long-standing lymphedema, my guess is that the fluid sitting under your arm has started to become thick and fibrotic, meaning that it is no longer moving normally under normal circumstances. In these cases, the research shows that not only is more pressure appropriate, but that it is warranted. Pressures of about 30 millimeters of mercury, or the same as your compression garment, which is more than this, is what's going to help move fluid out of the upper arm back towards the axilla and back into central circulation. Now, if you're talking about really thick tissue in your forearm or in your leg or calf or elsewhere on your body, sometimes you really need to put a lot of pressure into that hardened tissue until you can actually feel some of that change. And then your pressure might be a little bit stronger up the limb as well. So not only is more pressure appropriate, but again, it is warranted in certain areas of the body when you have that thick, fatty, fibrotic tissue that this is no longer benefiting. So read all of the details of the study below. It's posted in the description, and let me know what you think. Are you seeing the results you want with petting the kitty? Or are you really requiring your body to go deeper and stronger into that tissue in order to get the results that you're looking for? Tell me what you're doing, what's working for you, and what else you're doing for that thick fibrotic tissue to see improvements. Thanks for joining me.